Hello, I'm Emily Widnall from the University of Bristol, and I'm going to be talking through the Peer Education Project, which is part of the Public Health Practice Evaluation Scheme. This is an intervention that's designed and delivered by the Mental Health Foundation, and then the University of Bristol and Lancaster University are leading the research evaluation. So some background to the study and evidence of need. So up to 50% of mental health problems are established by age 14, and we've seen an increasing prevalence of emotional disorders among the secondary school age group across the past several years. And we've also seen a knowledge gap amongst young people regarding recognition of the signs and symptoms of mental health problems, that's both in themselves and others. And that knowledge gap and lack of awareness of the signs of mental ill health can often prevent timely help-seeking behaviours. So what the peer-delivered mental health education seeks is to model young people's tendency to turn to their peers for support and advice, perhaps over a trusted adult or member of school staff. So the intervention overview is, there's 4 components to the intervention. So the Mental Health Foundation trains staff. The school staff then select and train peer educators, typically Year 12 students, and then these Year 12 students deliver lessons to their Year 7 peers. And then the Mental Health Foundation provide a range of resources to support the schools to continue to focus on mental health once the intervention is finished. So that's the continuing the conversation element. So the rationale, the intervention is universal, peer-led, educational and school-based. And the content of the sessions that the Year 12s teach their younger peers are: what is mental health? Why do mental health problems happen? Staying well, looking after yourself and looking after each other. So the study aims are to understand how the peer education intervention currently works in schools and what that looks like, to refine the theoretical model that underpins it, and to establish the best outcome measures to measure mental health literacy and as well as help seeking. And within that, we're looking to develop and test novel mental health literacy questionnaires. So the research questions, really we want to understand how both the Year 7s and Year 12s experience the peer education project, what are school staff's views of the peer education project in terms of implementing in their school, and to what extent do schools embed peer education in wider whole school approaches once the intervention is finished. And as well, what are the most appropriate primary and secondary outcome measures and the best way of collecting these. And the final research question really is within the context of COVID-19. Some or all of the intervention may have to be delivered online. So what are student and staff experiences of online training and intervention delivery, particularly thinking about the restrictions that we currently have with kind of year group bubbles. So it may look as though Year 12s may have to virtually kind of teach their younger peers, and what that looks like in terms of the mechanisms within the peer education model. So the study population, we're recruiting secondary schools in southwest and northwest of England, typically Year 12 students teaching Year 7 students, and we're looking to recruit 4 to 6 new schools that haven't had the intervention before, as well as recruiting 2 current user schools. So those are schools that have already delivered the intervention, and we're looking to understand how that's impacted on their mental health focus in the future. So the study design is a process evaluation and pre and post survey. So the process evaluation consists of observations of the training and delivery of the sessions, student focus groups and interviews with school staff. The survey before and after the intervention includes questions on student help seeking behaviours, mental health literacy, peer support and well-being. And that survey, we hope, will give us a better understanding of which outcome measures to use potentially for a future trial, as well as doing some validation work on some novel mental health literacy questionnaires that we've designed with the Mental Health Foundation. In terms of impact, what we hope is to update and refine the peer education theory of change, understand how the peer education model impacts both peer educators and peer learners, as well as the wider school community, and we hope to use the findings to adapt and improve the programme content moving forwards in the hope to deliver an improved programme to schools in the future. Okay, I'm aware there's space for questions, but I'll end it there. Thank you.